Not only is California's baby boom generation dealing with their own retirement issues, many are dealing with parents and loved ones who need help with such things as shopping and getting to appointments, and later perhaps skilled nursing care. What types of senior support services will be needed in the future? How can we make sure that seniors can live at home as long as possible? And when more care is needed, how do we make sure that nursing home facilities are both available and affordable? Our guest is Laurel Beck, an expert on issues impacting senior citizens with the Nonpartisan Public Policy Institute of California. In-home support services and nursing homes, the coming senior care tsunami.
Additional funding for the Maddy report made possible by a grant from The Wonderful Company, harvesting health and happiness around the world. From the California Channel at the State Capitol and the Maddy Institute, it's the Maddy Report with Executive Director of the Maddy Institute, Mark Kepler.
Welcome. Recently, the Nonpartisan Public Policy Institute of California released a series of reports relating to elder care in California. Our guest is Laurel Beck, one of the authors of those reports and an expert on aging issues. Welcome.
Thank you.
So there are lots of ways to provide elder care. You've got nursing home care, you've got assisted living. One of the most popular, though, is in-home support services. Can you talk a little bit about in-home support services?
Yes. So in-home supportive services is actually kind of a program that's related to a larger field of services called home and community-based services. But IHSS itself is a service that's provided through Medi-Cal, and that's California's Medicaid program. And what IHSS does is it provides funds for disabled people to pay for services to be provided in their own home. So you get to hire a provider to come and provide personal support services, and that can include, bathing and personal care. It can help laundry, cooking, help with errands, and other things that enable you to stay in your home.
I think a lot of older people probably want to stay in the house.
Yes, exactly.
Right? It's comfortable, it's familiar. So are we talking about paying for this? Do seniors pay for that themselves, or are they getting? Is this being paid for exclusively through Medi-Cal?
So the IHSS program itself is exclusively through Medi-Cal. So that's in that situation, if you qualify based on income, and for the state of California, to be eligible for Medi-Cal, you have to fall below 138% of the federal poverty line, which for 2 adults.
So a little bit more than the poverty line.
So it ends up being about $22,000 for 2 adults, and if you fall under that level of income, then you can qualify for IHSS if you're disabled, and the state will give you money to hire a worker. But if you fall above that line, there are private market
right.
groups.
It still might be cost effective. We can talk about that in a little bit. But about a half a million people, I think the number was 467,000 are in this program. It's a pretty substantial amount.
And growing.
And growing, yeah. So one thing I was a little surprised to learn, I think our audience might be surprised to learn, is that these in-home providers can be relatives.
Yes.
So is that a common practice, and can anyone just sign up a relative to do this and get paid?
It is common as relative. California is one of several states that does allow that, and it ends up being a really important income support for families with disabled members. Often when somebody suffers from a disability, their spouse or their children end up having to leave the labor force or cut back on their hours at work, which is a really significant hit to income. So in addition to dealing with a family suffering from health problems, they're also dealing from the loss of income. And so because California allows you to kind of hire a family member to provide services, it provides
and we're talking
support.
About lower income people.
Yes, so, by definition for IHSS. So it's
right. So you want them to have some kind of income coming in, and they can at least take care of their relative at the same time. And I assume they've got to go through the whole process of an application.
So yeah, so anybody, you don't have to be a family member, kind of anybody can apply, and counties have a lot of control in the background checks they run and the different kinds of training that they do.
So what I was reading is that the California IHSS program is moving toward managed care, which I believe that's different than fee-for-service, right?
It is, yes.
So what exactly is it? Why are they moving? What are the implications?
So the idea behind managed care is that the people who are benefiting from IHSS, a lot of senior Medicaid beneficiaries, touch a lot of different providers. They have multiple conditions. They may require a lot of help, and coordinating across those providers can lead to more efficiency. It can reduce duplication of services. The potential downsides are, one, that these programs end up losing some autonomy in how they run the programs. IHSS, instead of having independence in how they select providers or how hours are distributed, has to coordinate with other services. Right. It's also, the transition to managed care has been bumpy because this is such a vulnerable population. These are, by definition, kind of low-income disabled people, and so throwing kind of curveballs and changing the types of care they're getting, who their providers are.
They got physical issues, mental issues, and all those kinds of things. So who's responsible for administering IHSS? You got the federal government, you got the state government, you got county government. Who does what?
So it's a Medi-Cal program, which means it's largely funded by this. It's split between the state of California and the federal government, but control is almost entirely at the county level. So counties determine wages, counties determine training and background checks. So most of the decisions are made at the county level.
So, but I would think he who has the gold makes the rules, though. So if you're getting money from the feds and the states, even though it's administered by the county, they're still following rules.
They are. There is state oversight, certainly, but a lot of the, again, a lot of the work that ends up happening is in recruiting and training and matching providers to patients who don't have family members that they're hiring, and all of that is handled at the county level.
And I assume they get some kind of financial support by the state and the federal government to administer those programs. So how stable is federal and state funding for these programs? I mean, you're seeing a Republican Congress now coming in, a Republican president. There are going to be cuts in funding. If there's cuts in funding, what does that mean for the state budget?
There's a lot of big questions on that. I think we really don't know. In Congress, they're talking about repealing Obamacare, the Affordable Care Act, and that the federal government provides 50% of funding for Medi-Cal, including the IHSS program. And so if there were significant cuts at the federal level, then that could have significant cuts in either the level of benefits received or people who are eligible for the program.
And just recently, the California state budget increased the number of hours. It was a 7% cut in service hours. They put that back into the budget, and now who knows what's going to happen if they lose federal funding.
Who knows, exactly.
All right, well, up next we're going to talk about what if mom or dad needs more care? What about nursing homes? Are they a viable option? That conversation in a moment. This is the Maddy Report. Welcome back. We're talking with Laurel Beck, an expert on aging issues with the Nonpartisan Public Policy Institute of California. Nursing homes, another option. They provide room and board, they provide on-site nursing care, they provide supervision and personal assistance to people who really are unable to care for themselves at that point in their lives. So, nursing homes, do they have to be licensed?
Yes, is the short answer. Usually when we talk about nursing homes, we kind of mean skilled nursing facilities, which is the technical term. And in order to be to become a skilled nursing facility and qualify for the funding that comes along with that, you have to be licensed.
Actually, you make a really good point, which I probably should want to highlight, is that these are different terms here, right? Assisted living, nursing care, very different terms. And anyone who has parents that are aging knows the difference between these terms, but just to be clear for our audience. So we have an agency, I assume that's a state agency that...
the CDPH, the California Department of Public Health, is in charge of certifying people, or certifying institutions as skilled nursing facilities.
Okay, so how many of those exist? How many nursing home skilled facilities exist in California?
In 2014, which is the most recent data that we use in our report, it's 1,220 across the state.
Okay, and you're serving about 100,000 patients, I understand. That's a good number. So we got an elderly parent who needs nursing home care. How much does it typically cost?
The cost varies tremendously. I'm hesitant to cite a specific number because it can depend on how intense the care they need is. It can depend on where they are in the state. It can depend on whether or not they share a room.
Okay, give us an ish.
An ish. It is pretty much always the most expensive option, aside from having 24-hour care in your own home, and it can be easily $100,000.
Okay, and so so we have, are those patients covered by Medi-Cal or Medicare?
So,
or is that cost taken up by Medi-Cal or Medicare?
Rarely, so if you are low income, you can qualify for Medi-Cal, and Medi-Cal will pay for it. But if you have Medi-Cal, then you are more likely to have a shared room. Medi-Cal is not going to pay for your posh private room in a really
right. And there's a difference between semi-private and private rooms.
Yes,
more expensive for private.
And Medicare will pay for patients who have just come out of a hospital stay and just need rehabilitative.
So you fall down, you break your ankle. You need some time to rehabilitate. So you go to a skilled nursing facility till you get better. Then you go back to assisted living, maybe, or senior living.
Yes, or back to your own home even.
Right.
Yes.
And I think I was reading in your report, there's something like, you said about 3/4 of the people in skilled nursing facilities are either getting Medi-Cal or Medicare payments to take care of that. So state demographics are changing. I assume that means that demographics in nursing homes are changing as well.
That is true.
To what extent? What does it look like?
It's going to become very rapid over the next 2 decades. We saw large inflows of immigration in the 70s and 80s from Mexico, from Latin America, from Asia. And those people who immigrated in their 20s and 30s are now reaching retirement age. And so
they're a baby boom generation.
They're also boomers, exactly.
Right.
And so the California in particular's baby boomer generation has already started to hit retirement age. That's going to continue through 2030. And we are going to see really, really significant growth in the number of, or in the fraction of seniors that are especially of Latino or Asian background.
Yes, and the white proportion of the population is going to go down a little bit.
It's
percentage.
the proportion, yeah. That's
Percentage,
all
percentage.
of the
The
different
numbers are all going up,
Yeah,
but the
exactly.
percentage is going down.
Exactly,
Okay.
yes.
So just a more demographically mixed senior population. So a senior ends up in a nursing home. Does that stay typically a short stay or a long stay?
It really varies a lot. I think that there's this conception that people only go to nursing homes when they can't live independently and it's a permanent stay. And we did, about 59% of nursing home patients are covered by Medi-Cal. That's by definition for long-term stays. So most nursing home patients are there for a long time. But if you look at it on a stay-by-stay basis, it's actually, most stays are for under 3 months.
So it's those people that, like I said, broke an ankle and they're getting rehabilitation, they can't really do it on their own, and then they go back to senior living. It's not a situation where someone goes into a nursing home necessarily and stays there for 3 or 4 years.
Yes, exactly. So in 2014, for instance, 34% of stays were for fewer than 2 weeks.
Okay.
So,
okay, so that's where it primarily is. You did note in your report that California has a larger share of highly rated, good news, nursing homes than the nation as a whole, but the quality of care varies from region to region. What were your findings?
So according to data from OSHPD, which is a California agency, California does pretty well overall compared to the rest of the country. That masks regional variation. And so according to their data, the lowest fraction of highly rated homes are in the most northern part of the state and in Los Angeles and Orange County and the Inland Empire. But again, that masks variation. There are a lot of good homes in those places, but a relatively high fraction.
You know, what's interesting for our audience is they don't probably understand that they can actually find information on the quality of care, and so they look at things like the number of health inspections, nursing staff hours, and other quality measures. So if you have an aging parent, you can actually find out about these different nursing homes and where you want to put your loved one based on how good they are.
There are lots of websites. It's worth Googling. AARP certainly works hard to try and make that information as accessible as possible to people who are looking for their options.
Yeah, and it's not an inexpensive option anyway, so it's something you'd probably spend some time researching. Now, you've suggested that nursing homes could do a better job by coordinating with other long-term support services. How so?
I think the biggest thing that is a challenge for people involved at all parts of this process is finding the right level of care for people. There's such a spectrum of just needing a little bit of help in your own home to needing 24-hour care. Yeah. People want independence, people want freedom, and so having this trade-off of not wanting to spend too much money or too much effort on people who don't require those inputs and giving people independence. And I think that's just making sure that the care is available for people who need it, but that other options further down the spectrum of needs are also available is just a really difficult challenge that we need to keep doing better.
Yeah, well, we're going to talk next about nursing homes for mom and dad. Will you be able to find one if you need one? That kind of depends. We'll have that conversation in a moment. This is the Maddy Report. Welcome back. We're talking with Laurel Beck with the Nonpartisan Public Policy Institute of California about the availability of nursing home care in California. You know, with people living longer, is it fair to assume that the demand for skilled nursing is going to continue to increase?
Yes, it has been going down actually since about the 1990s. We saw a peak level of usage and it's been going down. But now people are living longer and they're just going to be...
So it's going down, is that because they're doing in-home support services maybe a little bit?
Home and community-based services or IHSS or assisted living and other kind of intermediary levels. And
before, I'm not sure, maybe you can correct me, but did those services actually exist, 20, 30 years ago?
Not much less so. There's really been a lot of growth.
A big
in
demand,
yes.
I think. Okay, so I'm sorry for interrupting.
No, it's fine.
So anyway, so the demand for skilled nursing, even so, we're going to see probably an increase?
People are living longer and there are going to be way more seniors. I can't emphasize enough. The baby boomer generation is a really big bubble in the population over time. And so as the boomers hit retirement age, more of them and they're living longer, we'll definitely see an increase in
one of the things you mentioned in your report that the senior population growth rates are going to vary by region. So how much variation are we talking about, and which regions are going to have the greatest growth in senior populations?
We were surprised by how much variation there will be in the overall senior population growth. We use data from the California Department of Finance, and their numbers project that the slowest growth will be in the Central Coast region, which is kind of from Santa Barbara up to Monterey, and up in the Northern California, which is we count as kind of everything above Sacramento, and that's slow growth at 69%, which is really actually pretty fast.
Right.
And meanwhile, they project the fastest growth in the Inland Empire region, which is San Bernardino and Riverside counties, and they have that at 105%, which is over doubling.
And the San Joaquin Valley is right up there too.
Exactly.
It's interesting, those are also the areas that also have the highest just general population growth rates as well, so I guess it's not entirely surprising. Now, you found that it's not just where the population is aging, but the demographics of California seniors that are changing. And so what's the biggest demographic changes that you're seeing?
There's a few. One, just more people. Two, they're living longer. But we also, and the difference in the race and ethnic composition.
That makes, that living longer, that makes those of us getting older to feel a little better, right?
Even those of us who are.
Right.
The other thing that is really pronounced is that people are more likely to have never been married. They're less likely to have children than they were, kind of, again, in the 70s and 80s. We saw differences in how people married or didn't, how they formed households. And so as those people have aged, they're less likely to have family members who are willing and able to provide support for them. They're also more likely to live far away from any
kind of the nuclear family or a nuclear individual, I suppose. There's nobody there to provide the support services, so then...
Or less likely to be the case, yeah. And
or there's a distance there too, that's the other issue.
And our work does suggest that people in that situation are more likely to rely on either privately funded or publicly funded services to provide them support when they need it.
Yeah, so so changing, how will changing location and demographics, I'm just thinking of, for seniors, impact the demand for nursing care?
So there are a lot of things which determine whether a person uses a nursing home, which is like how much care they need, whether they have alternatives such as assisted living, how much they can afford, can they, if Medi-Cal will pay for the nursing home but won't cover assisted living, then that
You think you may need the service, but what if you can't afford it? Yeah, that's a big deal. And if we're talking also about changes from federal funding possibly coming forward, those are families, I suppose, that have to pick up that cost. I mean, mom and dad are moving back home.
It's entirely likely. Again, a lot of question marks on federal funding, but if
so you're saying financial issues, health issues,
intensity of care. People want to have care that's close to them, close to their communities, close to their families, which is, gets into the importance of being regionally available. And
it's disconcerting, I would think, if you were living for a long time in an area, and now you can't afford to stay there. You have to move, maybe closer to your kids. That's a pretty big shock to some of these seniors.
It is, and I think that there's a good understanding that having people being connected to their community and feeling like they are, connected to the community is a really important thing, and uprooting people can lead to isolation and depression and a bunch of other outcomes which are not ideal.
There's also some cultural differences going forward, and how is that playing, what role does that play in all of this?
It plays a huge difference, I think, and we may talk more about this later. I think that people do better, they have better outcomes when they have neighbors and friends and caregivers who speak their language, who cook their food, who respect their religions, who respect their lifestyles. And so being in an environment where you're comfortable, where you, again, can communicate effectively with people, where people take off the shoes if you don't want shoes in your house.
I can relate to that. I have relatives. That is a big deal.
That is a big deal. And so the cultural diversity, even as I'm talking about Latino and Asian, there's a lot of diversity within the Asian subpopulation. Speaking Korean and my caregiver speaks Chinese, we can't communicate. And so that's a really important thing to keep in mind, is how diverse California is. And these just state level numbers of we have this many caregivers and this many people, or this many beds and this many people, mask a lot of...
Right, you may not have the right caregiver with the right language skills, cultural awareness skills to help that senior.
In the right region.
In the right region.
With the right medical skills.
So the macro numbers kind of hide some of the micro kind of issues that are bubbling beneath the surface.
Which is why this is important both at the state and the local levels.
Okay, well, up next we're going to talk about what state and local leaders can do to improve elder care in California. That conversation in a moment. This is the Maddy Report. Welcome back. The data show that we're going to have a greater demand for all health and personal services, including skilled nursing care for our seniors. Now, how can we make sure that that care is affordable and accessible to California seniors? We're talking with an expert in aging populations, Laurel Beck, from the Nonpartisan Public Policy Institute of California. So will there be enough nursing home capacity to keep up with demand?
That is a tricky question. It kind of depends at what level you talk about. Currently, most of the nursing homes in the state have some extra capacity. At all regions, there's a little bit of room to absorb some growth. And we have seen increases in the number of nursing home beds across the state over the past 10 years or so. However, our report projects that the demand for nursing home care is going to rise significantly. And we don't think that 2016 capacity is enough to meet 2030 demand.
Which, by the way, isn't that far away. 14 years will happen pretty fast.
It takes a while to build
a nursing home. And there's that tsunami of baby boomers.
The silver tsunami.
Silver tsunami, that are aging and they're living longer.
And so if nursing homes continue to increase capacity at the rate that they have at a state level, we'll be about on track. That, however, masks tremendous regional variation.
Yeah, I want to ask you about that regional variation. You know, how are we doing regionally? Are there going to be, you know, gaps in coverage?
We project that there are going to be gaps. I think that there are a couple of factors at play. One of them is that regions have differences in how much sort of extra capacity they have right now to absorb. And then there's also, as we talked about before, a lot of variation in how quickly the senior population is growing, and by implication, the demand for nursing homes.
So you could have a double whammy effect where you could have not very high capacity and a burgeoning senior population.
Exactly. So what we find is that the population, or the Central Coast, which we said is kind of from Santa Barbara to Monterey, and Northern California are the ones facing the slowest growth in their over 65 populations, and our report says that they're kind of in the best shape to absorb the growing population.
So everybody wants to move over to the Central Coast for the weather, but okay, until that point.
And then on the other hand, the Bay Area and the San Joaquin Valley, the Central Valley and the Central Sierra, look like they...
Which, you know, I found that, I saw that in your report, I found that interesting. I understand the San Joaquin Valley because the population growth is generally pretty larger, but the Bay Area? That's kind of surprising.
The Bay Area is going to, it is both relatively rapid growth and just already being pretty close to capacity.
Well, that's the housing issue probably.
The housing issue is a big part of it.
Can you imagine trying to live, you know, in San Francisco with those rates? It's
pretty tough.
It would be a challenge for a senior. So what can or should state and local leaders do to support our seniors with the greatest needs?
So again, an in-depth question. There's a lot to talk about. I think a good place to start is the states had a Senate Select Committee on Aging and Long-Term Care that released a big report last year. And they had loads and loads of recommendations about what people can do at every level. At the state level, they emphasize the importance of leadership and funding, and then coordination across many agencies. If you need some help and you go onto state websites, it's a complete maze. It's incredibly disorienting about which services you qualify for.
Department of Public Health, they got this other department. And,
Which ones, is it something that's administered by the county? Where in the county is the office? What number do I call? And that's a real hurdle for people to kind of get the services.
I would think, and particularly seniors too, because they're dealing with multiple medications. Now they got to deal with multiple agencies.
Or it's their spouse or child who's trying to do it on their behalf, and has
part-time with a full-time job, probably raising kids.
This is both the caregiver and the senior populations. It's making it more complicated. Is not helpful. They also talk about at the local level, there's a need for training and supporting a qualified, culturally competent healthcare workforce. And a lot of times when we talk about healthcare workforce, people think of doctors and nurses, but it's in-home support workers, it's nursing aides, it's medical aides, it's radiology technicians.
So a lot of this could be community colleges and those kinds of things, which is interesting if you're trying to address unemployment issues too. This could be, you get a twofer, right? You're taking care of unemployment and you're taking care of a need that society has, these caregivers.
But PPIC has done other work that suggests that healthcare workforce issues are really important for the state. And that's something that can be handled both at the state, but then also at kind of the local level.
Anything else you think that we should be focusing on?
I think the other thing that is worth mentioning is just also having supports for family caregivers. Again, if your spouse is disabled and needs support, if your parents are disabled and need support, it's a real burden. People suffer from exhaustion and depression.
Yeah, I mean, you're dealing with a full-time job and a full-time caregiver. That's tough on the caregiver.
And so the need for caregiver supports is also kind of, it's easy to overlook, but it's a really important auxiliary kind of set of
Great overview. Thank you very much. Laurel Beck with the Nonpartisan Public Policy Institute of California. Thanks for joining us. If you want to stay current with state and local politics, you can follow the Maddy Institute on Facebook, Twitter, or log on to our website at maddyinstitute.org. This is Mark Kepler for the Maddy Report. Thanks for joining us. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect those of the California Channel or the Maddy Institute. If you'd like to share your thoughts about the points and opinions expressed on the Maddy Report, visit our website at maddyinstitute.org.